to be very honest with you, I expected the holiday numbers to be worse than they are. So I think that we're going to be all right in the long term. There is light at the end of the tunnel, as the judge said. Now, as to vaccines, I know that this has been kind of a frustrating road for everyone, but I do want to give you an update on where we are right now. I've had a lot of conversations this week about vaccination. We at the health district have not received ours yet. We are among a number of providers, as I've been told, that have not received vaccine yet. The process for getting that vaccine is a bit of a lengthy one, but we are in communication with DSHS trying to get that sorted out, and we hope to have that sorted soon. For those providers that do have vaccine, I know that the question we receive most frequently is, when do the phase 1B groups get their vaccine? That's going to depend on availability of vaccine at providers that currently have it. So really it's going to be a matter of contacting your pharmacies that have the vaccine, your healthcare providers, and to see when they expect to be able to widen out those vaccination allotments. And that's going to depend on, again, their stock of vaccine. I think that's all I have from me.
All right, thank you, Dr. Chadwell. At this time, I'll open it up for questions. I don't know if we have the capability to recognize hand raising. We not, I'm told. So just be cognizant that there are several folks on the line. So if you have a question, I'd be happy to try to address that or direct it to Dr. Chadwell. Yes. Hi, Andrew.
Hi, this is Andrew Moore with Channel 6 News. I saw that in week 4, it looked like Baylor Scott and White was the only provider that got any additional vaccines in Bell County. Is there any information provided to you all about maybe what week 5 would look like, how far in advance you're going to have to wait to get whether the vaccine at the health district, or see that given to some other additional providers that is, you know, not only Baylor Scott and White, but might include an HEB or some other pharmacies or something like that?
So I do know some of the local pharmacies have received allotments of vaccine, and I am not privy to the process for deciding who gets vaccine and when. What I do know is that providers have to use their vaccine, log that they've used their vaccine in order to be eligible to order more. But that's the extent to which I'm aware of that process. As for us, we have been, like I said, in communication with the state, and we are expecting to get vaccine. We're expecting Moderna first. Our first allotment probably won't be that big, so I don't know that we'll have enough to open any large-scale clinics in our first allotments, but we will be targeting our tier 2s and vaccinating them via clinic visits and site visits and things of that nature. But as far as when we're going to have large numbers of vaccine, that's going to depend on a number of factors, and I can't really justify what all of those are since I'm not making those decisions.
Who can sign up for that wait list that's put up? Oh, I'm sorry.
No, Andrew, I was just going to add that, or echo those comments. The discussions that I've had with the state indicate that, well, first of all, I can't tell you exactly what the formula is for when and how they ship or to where, but that process is ongoing, and I have been advised that we should be expecting to see more shipments of vaccines in the coming days. But again, I can't give you a schedule or a number or a quantity at this time. The state simply hasn't provided that to us.
And the health district does plan, and exactly what this will look like, I can't tell you yet because we have to start receiving vaccine, but we do plan to add a component to our dashboard to share with you guys when we get vaccine and when we're using it, so that it's easy to track, at least with us, but we won't have that available until later down the line.
Okay, who would be able to sign up for that wait list that you put on Facebook?
So the wait list is open to anyone who wants to put their name on it. The intent with that wait list is, for Moderna, for example, once you crack the vial open, there are 10 vaccines in it. You want to use them as quickly as you can. So what we don't want to happen is we make 10 appointments and only 6 people show up, and we have additional people that we're trying to get vaccinated. That wait list is going to help us pull people when we need to quickly vaccinate and use that vaccine so that we don't waste it. So anyone who wants to put their name on it is eligible to do that. We will target those in the priority groups. That's what those check boxes are for, to designate priority groups. Yes, anybody who wants to be on it, go ahead and put your name on it.
So that's that could be somebody not, that could even be the general public if they don't have to fit into phase 1B, anything like that.
Right, they do not have to. They can go ahead and put their name on the list now. That way, when we start getting to the point of vaccinating the general public, we have a list to pull from to make appointments. It'll make our lives easier.
Okay.
And that link is provided on the Bell County Public Health District website. Very simple. You just click on it. I think there's only 4 or 5 boxes to fill in, and you're on the list.
It's very quick.
All right. Anything else, Andrew?
That should be it.
Thank you, sir. Any other questions?
25 minutes.
Yes, sir.
When it comes to closing down the bars again, I know it's going to be, controversial for a lot of people, but when you say there's a mixed license, does that apply to bars who have since designated as restaurants as well, but still serve mixed drinks?
Let me see if I can paraphrase the question so that everybody else can hear it, and I'm not sure I'm going to be able to do it. So I think the question is along the lines of what types of bars or what types of establishments that have TABC licenses, who does it affect and how does it affect them? If you look on the TABC website, I think I counted, 15 or 16 different types of permits or licenses that TABC issues to bars. And so there's 12, 13, 14, 15 different categories. I really am not in a position to tell you what the impact is on each one of those permits or each one of those licenses, which is why I'm suggesting that if you're a bar owner or operator, you know what your permit is, you know what license you have from TABC, and I would urge you to contact them and tell them, they'll know also what your permit or license categorization is and whether or not that's impacted by this governor's order.
And when we talk about rolling back to 50% capacity in a lot of areas such as restaurants and other things, is there any type of enforcement that's going to happen on the county level if they don't abide by the new regulations or rollbacks?
The enforcement level for this stage or this issue that we're in right now will be the same as it has been previously under the governor's orders, and that is state enforcement. So most of our enforcement activities, all of our enforcement activities, I think, have been initiated primarily complaint driven. So someone will call and say there's an issue or a concern about non-compliance for an establishment or business. That is turned over to the appropriate state agency or state enforcement agency, and then they take whatever action they deem appropriate.
And in particular, the bars, as we've seen in other areas around the country, when closures happen, a lot of bars are not going to comply or seem to have not complied. Do you expect anything like that to happen around here, given the last time this happened?
I don't know. I don't know.
Oh, yeah. So, thank you, sir. Appreciate it.
Any other questions?
Hi, Judge. This is Megan with KWTX.
Hi, Megan.
I know last week you had mentioned that you were going to, based on some of the complaints the county was getting, you were going to try to contact our local TABC officers or whoever investigates those cases to see if bars were in fact an issue, if there was non-compliance there. I was curious if you've heard anything back on that.
Yes, thank you for reminding me that. I have had actually multiple conversations with TABC officials over the past several days. They've indicated again there's over 300 licensed or permitted TABC establishments in Bell County. And again, 43 of those possess the mixed beverage permit, which is directly impacted by this governor's order. They did indicate that they are working complaints and investigating those complaints in Bell County, and that they have received some relative to the bar operations. And that's really all they could share with me at this time, was that they have received some complaints and they are working those.
Okay, thank you.
Any other questions?
I know this might not be at your fingertips. They didn't give you any sort of particular rough number of complaints, did they?
No, I did not get an actual number. They did indicate that, again, just as I said, that they have received complaints and that they are working and investigating those.
Okay, and just to be completely clear on this, you, I guess, had to file additional paperwork with TABC or with the state to continue to allow some of those bars to be open in that kind of to-go capacity?
No, that's, and if I misspoke, I apologize. No, what I had to file, again, right after I got the notification from DSHS that we were an area of high hospitalization, TABC sent me a notice saying I needed to amend the opt-in form that TABC had created to allow bars to be open in Bell County. This was from several weeks, months ago. I amended that form, and the box that I had to check, and I'll just read to you what that box said, but the box said, I have previously opted in for the reopening of bars, and subsequently, my county has become ineligible. And that's the box I had to check because we are now an area of high hospitalization, which makes our county ineligible to opt in. So I checked that box, signed the form electronically, and sent it back to TABC. And they have acknowledged receipt of it this morning.
Oh, okay. Okay, sounds good.
All right.
This might be a question for Amanda Chadwell. Adam Schiller, 25 News again. The hospital rate is steadily kind of rising a little bit. Do we anticipate, given holiday decreases, it to get as bad as anywhere else that we've seen in the country, or is Bell County particularly in the safe kind of leveling out?
Did you hear the question, Dr. Chadwell?
So just to paraphrase, make sure I understood the question, do we expect the hospitalization rate to get worse? Is that the question?
Yes, should people fear it getting as bad as we've seen in other places around the country?
So perhaps not as bad as some of the worst case scenarios we've seen. There have been some pretty bad horror stories lately. We do usually see the peak in hospitalization rates hit about 14 days after the peak in cases. So it will probably get, the anticipation and conversations I've had with our clinical workers is we might see it get a bit worse. But again, if we get compliance from the public in those measures that we've mentioned over and over again, we should be able to tamp this down. It's just going to be a matter of getting that compliance. So it might get a little bit worse, but I don't expect us to be, a Los Angeles kind of situation.
Is there anything we can say to the public to reinforce that they still need to comply even though vaccines have started to become available?
Yes, absolutely. So the vaccine, first of all, it's 2 doses. That's the thing we have to remember. And immunity is not immediately derived. Now, after dose 1, the indication is that illness might be less severe, but you still need that second dose, and it's about 7 to 14 days, depending on the vaccine, after that second dose before the full effect of that vaccine is reached. So just because you've had dose 1, it doesn't mean take off your mask and pretend the pandemic's over. So we need to remember that we need those 2 doses, that 7 to 14 day break after dose 2, and you also have to remember we're relying on a lot of people getting vaccinated. So we have small percentages of people vaccinated at this point in time. We have to build it up. And it's going to be a while before we get to a point where we say, you know what, we have enough people vaccinated that we feel comfortable without wearing masks. We're not there yet.
And that's a good, what I reemphasize on that point is, again, good news that the vaccines are now being distributed by the state from the feds. That's good news. That said, it is going to take weeks and months for that vaccine to actually be, for us to actually be inoculated across the population. We're attempting to do, I say we, the national government, the state government, and local health districts and local healthcare providers are attempting to do in weeks and months what historically has taken decades to do, and that's vaccinate an entire population. So it is a tremendous logistical effort that is being undertaken here. And there are going to be some hiccups and bumps along the way, I'm sure, as this rolls forward. But again, I think we should have confidence in the fact that the vaccine is here, and we're going to get that distributed, and we're going to get folks inoculated.
And if I could ask one more thing, I mean, just to stress the importance of continuing to wear masks and social distance, to protect more vulnerable people in our county. I think we just learned that Clean Councilman Jim Kilpatrick has passed away from this? And how important is it that people understand that people, they have certain conditions or, have, and are more elderly individuals? How important is it that people understand we're doing this to protect people like Jim Kilpatrick?
It's critically important. We have people in our population that are at high risk that may pass away as a result of this virus. And I know that it's kind of hard for people to see the forest for the trees when they're not in it. I'm looking at these death certificates every day. It's very apparent to me, and it's very apparent to our healthcare providers on the front lines taking care of these patients. We need to impart that message to the public who doesn't see it in their face all the time. That yes, it is very dangerous for quite a number of people, and we need to do everything that we can to protect them. It's not just about us as individuals, it's about us as a population.
Okay, thank you very much.
Last call for questions. I think I saw another one in the room. Oh,
Hi, it's Matt with KWTX.
hi, Matt.
Hi, so this is a question, we're getting a lot of calls. There's a lot of confusion about people, people that are in the 1B group. They're calling around, they're seeing that the vaccine is not available right now. What is being done to sort of, respond to some of this confusion in the community? I guess this is a question for Amanda.
So as far as the health district is concerned, we are explaining to people, of course, answering those questions as much as we can. I think the wait list has been a comfort to them to know that they can add their name and that we do see them and that they are going to be receiving that vaccine as soon as we can manage to get it to them. I think some of the confusion has been some of these processes, which include tracking not only shipment of vaccines, but provisioning of vaccines, and there's some lags there, and there's always a few hiccups in the road. This is a new process for a lot of people. So trying to impart that. And the thing to remember, and I think Dr. Hellerstadt in one of his statements from DSHS said this too, just because a community is eligible for vaccines in phase 1B, it doesn't mean we have enough vaccines for that group yet, but we will get to them as quickly as we can.
Thank you.
My comments on the confusion would be, yes, it is confusing. I can acknowledge that and recognize that. But what I would encourage folks to do is, again, to be, just as we're urging folks to continue to be vigilant about the social distancing and wearing your face coverings when you can and personal hygiene efforts, be vigilant about your observation of the vaccination process. Because I think it will be fluid also in the coming weeks and days as the vaccine gets more widely distributed to the providers. The providers will get better, I believe, at identifying the process for contacting them, the process for scheduling appointments. All of those things I think will improve in the coming days. And again, I want to underscore one more time, this is an unprecedented event. Not in our nation's history have we done something like this before. So it will be fluid as we go forward, but we are going to be moving forward. Any other questions? I think I saw one in the room.
Judge Rod Henry from the Temple Chamber. First, comment to you and your fellow commissioners. Thank you for the leadership that you have shown. We know this is difficult on your part, but just a matter of clarification. The governor's orders become effective when?
Immediately.
Immediately. Okay.
All of the orders that I read associated with GA32, which was actually Governor Abbott's order GA32, which was issued back in October of last year now, became effective with the official notification that I received from DSHS in the letter notifying me that we were a high area, high hospitalization area. So they are in effect now.
Thank you.
Any other
I have a
questions?
follow-up question.
Yes. Go ahead, Megan.
So thank you. When you say, that we are a high hospitalization area, what are you hearing from our local hospitals here in Bell County? Are they getting worried? Are the talks about opening, some of those extra facilities where we need to be housing COVID patients? How high are we, I guess?
Thank you for the question. I do have regular conversations with our healthcare authorities and providers in the county and beyond. And the short answer is, as I said a moment ago, they are stressed. Obviously, when you hit more than 15% of your hospital capacity, inpatient bed capacity is occupied by COVID-19 patients, that has an impact. And then with the governor's order on top of that, canceling elective surgeries, which is a significant issue for our hospitals and for our individuals who need surgeries that may be classified as elective, but nonetheless, they're surgeries. So it is a big deal, and it is an issue that our hospitals are dealing with. As I said earlier, they are stressed, but they are managing, and that's the message I continue to get from all three of them. Baylor Scott and White, Seton, and Advent have all indicated that same statement, that we're stressed, but we're managing right now. My hope is, as Dr. Chadwell alluded to earlier, that the next 2 or 3 weeks may be, from my assessment as a non-healthcare professional, may be the worst of hopefully what we see in terms of hospitalization across the county. And that after that, a combination of time and vaccinations and continued vigilance with the health protocols that we're calling folks to do, will see us begin to slowly decline and reverse those numbers. Any other questions? Not seeing any on the screen. I want to say thanks to all of you who participated today. We'll try to do these press, several months ago we were doing press conferences about once a week based on events. When we have new developments or significant developments, we'll try to schedule press conferences as warranted. Thank you.